Hello, everyone. Welcome to an exciting episode of our podcast. We are honored to introduce our distinguished guest, Dr. Manik Mathur, a consultant neurologist practicing in Guwahati, India. And today we are delving into a fascinating and often controversial subject within the realm of neurology cervical vertigo. Dr. Manik will shed light on the nuances of this condition and guide us through the avenues of care and treatment. Dr. Manik, it's a pleasure to have you here with us today.
Thank you so much. Thank you for inviting me, and thank you for lovely introduction. I'm highly honored to be on this platform, and I hope I can help people around, and more we can spread the awareness of cervical because it is one of the disease that is which is misunderstood at many platforms, many podiums, and so let's see what we come up to.
Yes, doctor. So let's start with our session. Doctor, can you provide an overview of what cervical vertigo is and how it is different from other forms of vertigo?
Okay, so first of all, we need to understand in this context that what is vertigo. So vertigo, in a common language, in a layman's language, we in Hindi we say chakkar, and in a layman's English we say spinning around. So vertigo are of many kinds. Okay, there can be many causes for vertigos. There can be brain-related causes. There can be ear-related, ENT-related causes can be there, and one of the most significant cause is cervical that we are discussing today. So, vertigo, any person who changes his position from sitting to standing, standing to sitting, moving around this direction, that direction, and he suddenly feels a bit of nausea for a fraction of a second. So that also comes into vertigo. Vertigo sometimes are associated with eye movements, different eye movements as well. So this is how vertigo is simplified and classified as that. In terms of cervical vertigo, yes, the cervical is the part of our neck that we are talking about. And from there, yes, vertigo develops. And there are many patients who come to us having vertigo, have been checked by ENT, having checked by medicine doctors, and they still are not getting the relief from their vertigos. So then we have to switch on to cervical, and we do find a pathology and we start treating them, and the results are promising.
So, doctor, what are the common symptoms and triggers associated with cervical vertigo? How it is diagnosed?
Okay, so in common words, if we see why cervical vertigo is very much common in women than in men, it's a ratio, you can say 6:4, 6 women out of 10 and 4 men. So because women who are especially household women who are washing their clothes, who are washing utensils, they're constantly in this form doing it, and their neck is always in a pressure to do. Secondly, women or men who go for outside for shopping, or they carry a bag on their shoulder all the way, that is also one of the triggers. Thirdly, people who are driving, whether it is women or men driving two-wheelers, they are also for long distances. In nowadays in Delhi, Mumbai, bigger cities, Hyderabad and all, there's a long durations of your driving, long distance that you have to cover on your two-wheelers. So that is one of the causes. Thirdly, taking wrong pillows in the night. Many people come and complain that, oh, I couldn't sleep with this pillow. I had to change, I had to remove the pillows. The wrong posture that they take while sleeping. That is also very much one of the cause of cervical. Then one of the most important is your job work. So there are many people who are in certain kind of jobs where they have to literally sit on the computer for hours, sit on the laptops, or even on the desk they sit, and they whole day they are like this. They're writing, they're typing, and constantly they've got this stiffness here, and they feel like doing this. So they are also that's also one of the triggers. So what we do is, I'll tell you in the prevention, what do we guide people to do with this. So these are the commonest triggers for cervical.
Thank you, doctor, for providing your perspective. And now, Dr. Manik, there has been extensive reporting on physical therapy as the treatment for cervical vertigo. So, can you tell us some effective non invasive techniques or therapies for managing this condition?
Yes, sure. Physiotherapy helps you in cervical in these such problems. But yes, in acute phase, when a patient comes to us that he or she is in a definite pain and definite vertigo, and they cannot even sit properly, and their whole arm is paining. There's a tingling sensation in your arms. There's constant pain on your shoulders. At that moment, at that precise moment, a person should withdraw themselves from physiotherapy or physical exercise or a physical treatment for at least 2 weeks. Once your acute phase settle down, then you start slowly start a physiotherapy. There are some forms of yoga that are very much good for cervical problems. So patients do feel comfortable in doing some people feel comfortable doing a yoga, some people comfortable in doing a physiotherapy. So in that ways, I believe, or I would recommend that if you're in an acute phase, do hold yourself for a while and then start your physical activity. Physiotherapy with the electric, there is electric means that they put it on your skin and they rub, like they give it electric massage, which is also very useful. Certain exercises of your neck, that is also very useful. So these are non-invasive techniques of cervical, and these do take time, but they are effective and you can do it anywhere without any hassle.
And doctor, is there any specific exercise or stretches that can help elevate symptoms of this condition? How do they work?
Benefiting, yes, yes, of course. Certain stretches for your back are always good in the morning or in the evening when you come home from work. Also, your whole body is tired from whole day. You need a fresh shower. After doing a shower, relax yourself, lie down on the floor, because there is nothing as flat as floor in this world. So if you lie down on the floor, give your back a rest, and all the muscles of your back come to calm for 15-20 minutes. Relax yourself, close your eyes, and then you start doing anything else. Secondly, the exercises that are most important are for the directions of the neck, up front and on the back. That is very much useful. It's very good, and it increases the blood supply in your muscles of your neck, which is very, very, very important. Thirdly, which I would recommend people that who are driving for like 30-40 minutes or above, um, even the two-wheelers or four-wheelers. Two-wheelers people have no choice, but the four-wheeler people have no choice. They've got the neck pillows in the car nowadays. You do get, and you can put them, and they are very effective for them.
Yeah, doctor. And in cases where conservative treatments aren't effective, what are the potential medical interventions or procedures that might be considered?
So, I mean, if the cervical is that bad that your medicines are not effective at all, you can always consult a cervical surgeon or a neurosurgeon who can further guide you for different operative processes. So, if I just take 1 minute here, that what cervical exactly means is that your cervical bones are like this, they're attached like that, and then there's a bulge in the middle which starts pressing them, and the nerve roots also get impacted in the middle. So that start causing you multiple kind of clinical scenarios that are seen. So when we opt for a non-medical, say the person has eaten the medicine for 6 months, he's been prescribed, or maybe a year, but still no relief at all. So then there's a call for a neurosurgeon where they go for there's a minor surgeries for this, and where I think local anesthesia they give, and the person needs to be on bed for at least a month, and then they're fine. But then, yes, the results are still 50-50, because it takes time for recovering from the surgery as well.
Yeah, thank you, Dr. Manik, for highlighting these interventions. Now, it's a commonly recommended practice that making lifestyle adjustments and adopting to healthier habits can significantly improve various conditions and manage health issues. So, what lifestyle modifications or habit that individuals prone to cervical vertigo should adopt to prevent or minimize its occurrence?
I mean, in recent times, we have seen that cervical patients have increased because of the stress that they are dealing in their day-to-day life, which is so huge that from your work stress to your home stress to your personal stress, there are many people who have no time for themselves. They are running around from 8 in the morning till 9 in the night, and then they go home and sleep. And next day again is the same routine. Saturday, Sundays are gone like that only. Again, they feel that, oh, the weekend is finished. But stress plays a very significant role. the person needs to relax themselves, not just the muscles of your neck, but the muscles of your brain as well. So once you relax them, once you relax yourself, once you calm down, the blood supply also decreases. The blood pressure comes down, because the cervical problems are also may also result into high blood pressures in body. So we need to understand that they're all married to each other, all the problems. This is the first one, is stress. Second comes up is your physical attribute. So your job profile. What is your job profile? If your job profile is, nowadays 70% people are sitting on the desk whole day, and especially with the COVID in the past, where people were working from home, they have been working in a different postures and lying down and all that. But now in the offices, you do not get that privilege to lie down and sit on the sofa and all. You have to be on the chairs. So people are facing difficulties now. People are facing it's very hard to adopt back into the normality of the working culture. So that is very important. So working people sitting on the chair for long times, kindly get up, give yourself a time, stretch yourself, stretch your neck, get up, get your computers, your laptops on a height where you're looking at the laptop like this, not like this. That is very important. When you're writing something, when you're doing, you have to need to get that onto a level where your neck stays 90 degrees straight, which is very much crucial. These are small things, but they do count up to the betterment of cervical pain and cervical vertigo. Yeah.
Yeah, doctor. Now, could you share a case study or a success story that highlights the successful management of cervical vertigo, and what were the key factors in achieving positive outcomes?
Sure. One of the case that I would like to share here was a 37-year-old female. She works for one of the reputed banks here in the city. She was when she presented to our clinic, she was in a severe pain, severe vertigo. She couldn't see down, she couldn't look down, she couldn't look up. That was the problem with her. She was very stiff in her neck looking at us, and she was constantly complaining of a right arm pain with vertigo and neck pain. We so we for before we could start anything on her, we told her to have some undergo certain investigations, such as MRI scan for her cervical. And in the MRI findings, we found that yes, she's got a massive bulge in the cervical, between the two bones of cervical, and she's got a nerve root which has been caught up there. So now the two routes we had from there, one was the surgery and second was medicines. So with discussion of the family and the patient, they were keen to go for medicine first. They would try a medicine route first, then to go for a surgery. Fine. We started a medicine route, and we started her on certain medicines that are classified as gabapentins, and we started them on that. We started certain creams, certain ointments that has to be put in the night, and the most important than the medicines is the precautions. We made her understand what precautions she needs. She needs to sleep on the floor. If she can manage without a pillow, so she did that. She was a very obedient kind of a patient. She agreed with that, and she used without a pillow. We told her that apart from going to toilet, shower, you are not getting up for the floor at least for 7 days. And it was a miracle. After 2 weeks, she came back, and she came back smiling, laughing. And when she entered the clinic, I couldn't recognize her. So things do work if you take really good precautions. You need to be very much serious, especially some certain patient come to us and they're like, oh, nothing's been changed. But because when you ask them deeply, did you rest? Did you give your neck a rest? Did you give your back a rest? No, they didn't. Oh, we just did a little bit of this. That doesn't work like that. So in winding up in this question, I mean, it is more important than medicine is the precautions.
Yeah, it's enlightening to hear how effective management strategies can lead to positive outcomes for individuals dealing with cervical vertigo. Such
Indeed.
insights offer hope and provide valuable information that can guide healthcare professionals in effectively addressing
True.
this condition. So, as we bring this session to a close, Dr. Manik, I want to express my sincere gratitude for your invaluable insights you have provided. Your expertise has illuminated our understanding, and we are truly appreciative of your presence and knowledge. Thank you so much.
I mean, thank you so much for your time, and thank you for inviting me. And as I said, I'm always just a button away. and I'm always there to help anyone around, anyone online, uh, without any restrictions. You can just get in touch with me. Thank you so much.
And to
Yeah.
our audience, we extend our gratitude for joining us today. Before we bid farewell, I would like you to explore our MedSynapse platform. This platform provides a unique opportunity to engage in enriching discussions, connect with esteemed medical professionals, and contribute to the progress of healthcare. Until we meet again, take care and keep advancing in your medical journey. I'm your host, Dr. Harshita, signing off. Bye bye.